Well, the primary responsibility for our organization is to create a way for unaffiliated and not currently connected healthcare organizations to connect to each other and to exchange clinical information in a way that it actually informs patient care. And we like to talk about the primary purpose of SHARE, or the State Health Alliance for Records Exchange, is to facilitate getting clinical information where it's needed, when it's needed, for the purpose it's needed. We have a network of rural health clinics, federally qualified health centers in the state, and by using relatively simple technology, in our terminology, what we call secure messaging, which is an encrypted email, they have found that it's a much less expensive way and a much more efficient way to move patient records between the hub organization, if you will, and their satellite clinics. They estimated they were spending somewhere in excess of $25,000 a year just for fax machines, fax lines, not even counting the kind of time and effort that employees were spending standing at the fax machine, chasing down faxes that had gotten distributed inappropriately somewhere else. So not only can it be more efficient, but quite frankly, it's in a much more HIPAA compliant way, because as we know, about anybody who walks by a fax machine can access whatever's coming over the machine. And so part of what secure messaging does, what this encrypted email does, it actually assures that both the sender and the receiver of the information are who they say they are. Certainly within the next 5 years, I envision the day when people will actually be thinking about and be using health information technology much in the way they use debit cards and cell phone and mobile devices, that critical information about what our health status is, what our current medication is, what our medical history is going to be almost routinely available. And so that when you walk into a specialist office that you've been referred to, we jokingly say our job is to remove the clipboards and the registration documents from every waiting room in the state of Arkansas. But I actually think that's not just a joke. I think it can be a reality within the next 5 years.